all, and thank you for attending my presentation here at the Giles T. Brown Research Symposium. Before I begin, I would like to thank the Symposium Committee for putting on this event, as well as my research mentor, Professor Gonzalez, who has helped me through my new and exciting journey of research. My name is Caitlyn Roum, and today I will be discussing a topic very near and dear to my heart. This is my grandmother, Mary. In 2010, Mary was diagnosed with Alzheimer's disease and fought it for 10 years. What started out as losing her keys or misspelling words turned into something much more. The people she once knew and loved became strangers. Her sense of self and autonomy disintegrated, and she became consumed by panic, anxiety, and disorientation. Up until the very final stages, music seemed to be our way of communicating with her. This picture depicts one of many times in which my cousin and I sang to her. This seemed to be a source of comfort for her and for us as well. As we would sing to her, she would often give us eye contact, say family members' names, or even say the words "I love" after barely being able to speak at all. After she passed away in 2020, I was determined to learn, determined to educate myself on Alzheimer's disease. Moreover, my experience with her led me to ponder, does music have the capability to help others like my grandmother? Is music therapy an effective treatment for patients with dementia? Inspired by my grandmother, I decided to start my journey in researching this topic. Now, to give some context to the process of dementia, specifically Alzheimer's disease, and its massive prevalence, I will provide a brief overview as well as some statistics to keep in mind. A large percentage of people with dementia have Alzheimer's disease. Alzheimer's disease, which can also be referred to as AD, causes the brain to shrink. Now, although this does happen to a certain degree with old age, the degree is far more significant for patients with AD. I will now discuss two main components of AD. The first component is the buildup of a particular type of amyloid plaque, which is a protein called the beta-amyloid 42 formis. This protein builds up in the brain and clumps, causing cell disruption and thus memory loss. The second component are abnormal amounts of neurofibrillary tangles. Neurofibrillary tangles, which are another type of protein called tau, collects inside neurons, blocks the neuron's transport system, which in turn harms vital processes such as recalling memories or even just participating in day-to-day activities. The buildup of amyloid plaque and the abnormal amount of neurofibrillary tangles are two main prominent features of Alzheimer's disease. Now, moving on to statistics. There are 55 million current cases of dementia worldwide, and 60% of those are due to Alzheimer's disease. Additionally, AD is among the top 10 leading causes of death among older individuals in the US. I realized through my research just how crucial it is to advocate for those who have this disease, as well as those who will have it in the future. This presentation will discuss studies I became familiar with as I wrote my literature review on this topic. I searched for peer-reviewed studies utilizing the OCC library database as well as Chapman University's library database. I then chose 12 studies to deconstruct in order to understand them to a deeper level. From there, I narrowed my research down to 5 different studies to write a literature review on. The contents of the literature review is what I am discussing today in my presentation. Additionally, today I will discuss 3 different domains in which the effects of music therapy were commonly addressed in the literature: mental health, physiology, and social impact. Starting with the mental health domain, I have included here 3 different studies that touch upon that provide key information about the effectiveness in the mental health domain. The first study is not directly related to music therapy, but instead found the importance of preserving one's mental health in order to delay the onset of AD. This 10-year-long longitudinal study was conducted to find correlations between the onset of AD AD and mental health factors such as depression, anxiety, or sleep disturbances. Patients were first evaluated on their mental health and their quality of sleep using the Neuropsychiatric Inventory Questionnaire. It is important to add that patients were screened for symptoms of AD before the study in order to ensure that they did not already have or weren't developing it. Over the 10-year period, they attended at least one follow-up appointment to record any changes in their mental health or sleep and were tested for probable dementia. It was ultimately found that there was a strong connection between patients who had eventually developed AD in the duration of the study and had chronic sleep disturbances, depression, anxiety, or a mix of multiple. Although this study did not directly pertain to music therapy, the next two studies I will discuss emphasize music therapy's effectiveness in improving mental health. This connection highlights the importance of mental health treatment for patients with dementia as well as those who want to prevent or delay its onset. The next study examined the effects of personalized music playlists for patients with dementia by utilizing a galvanic skin response test and analyzing facial expressions. The galvanic skin response test is a more accurate and tangible way of measuring emotional arousal to stimuli by measuring electrical conductance on the skin. The researchers of this study found that playlists profoundly impacted individuals. Factors such as tempo and key had the ability to modify a person's behavior. However, this study found that playlists must be made with caution. The results showed a strong correlation between minor keys, a fast tempo, and adverse effects such as agitation or even sadness. Against the researchers' initial hypothesis, stating that personalized playlists would benefit patients, personal playlists in particular did not have a significant effect on changing mood or behavior. In other words, playlists that were made based on the patient's prior music taste or recognizable music did not significantly affect arousal and mood. Now, this is not to say that personalized playlists should not be used at all. In fact, using personalized playlists can be a way for families to continue to bond with the patients. The literature is explaining that personalized playlists should be reviewed for factors that can be harmful to mood and behavior, like tempo and key. With this knowledge, playlists can be made with these factors in mind to avoid agitation and improve mood in patients. The third and final study under the mental health umbrella that also leads us to the physiological domain was a meta-analysis made up of 82 previous studies and found patterns in the results. The most prevalent pattern between music therapy and its effects on patients with dementia was improvements in mental health, behavior, and even verbal fluency. Music therapy modalities that improved verbal fluency included singing, songwriting, lyric reading, and group music therapy. While this analysis did not find significant improvements in cognitive function or memory, the findings emphasize that the symptoms that occur comorbid with dementia can potentially be treated by utilizing music therapy. Verbal fluency, as mentioned in the most recent article, transitions us into the physiological effects of music therapy on patients with dementia. A study was conducted to determine whether music therapy helps patients swallow and eat more. A common problem associated with more advanced dementia is losing the ability to feed oneself. Another common issue related to advanced dementia is dysphagia, a condition that affects the nervous system and makes swallowing painful, can cause reflux, ineffective chewing, and can lead to choking. The intervention used for this study was the Music and Memory Association, which is a non-profit organization that provides music therapy to patients all over the United States. Patients participated in this intervention 30 minutes before their mealtime over a period of time. Results of the study found a significant increase in their swallowing, and their food intake increased by 30% on average compared to when they did not listen to music before their mealtime. Furthermore, patients' weight loss was reduced, and their quality of life was improved over time. By improving swallowing and food intake, death due to choking, which are not very uncommon for this disease, can be potentially avoided. Deaths due to malnutrition, another common risk, can also be avoided. The improvement in eating can also be attributed to improvements in mental health and behavior due to music therapy. The previous studies mentioned show that music is linked with improving agitation. Furthermore, if patients are less agitated and calm, they may be able to eat with more ease. This indicates that there are many crossovers in the domains in which music therapy is effective. Moving on to our final domain, the social domain. The last study demonstrates the social effects that music therapy has on patients with dementia. The research of this study aimed to compare the impact of group music therapy to individualized music therapy. They also included a control group, which was not exposed to any music. Trained professionals used the positive and negative affect schedule on patients' behalf to determine the emotional effects of different conditions on them. Results showed that the group therapy condition had the most significant improvements in quality of life and outlook compared to the other conditions, suggesting that the effects of music therapy have a social component and that social opportunities for patients with dementia may be beneficial for improving their quality of life. Participating in activities such as group music therapy or even having family members spend quality time with the patient along with music may be a great way for patients to have beneficial social opportunities while also giving families a way to be helpful for the patient. Although these studies gave valuable information, limitations are presented. Most of the studies relied on self-report or observational studies. Future research would benefit from measurements that didn't rely on self-report or observational studies, but rather more tangible evidence. This could include functional magnetic resonance imaging, commonly known as fMRI, to measure brain activity in response to music. This could also be measuring respiration rates to measure arousal levels in response to music. The research on music therapy for dementia has major implications. By replicating this research and validating it, we potentially have an effective alternative therapy that can work alongside the efforts to combat dementia and Alzheimer's disease. Although there is no cure as of yet, therapies like music can improve quality of life, mental health, and behavior, which is a significant step in the right direction for advocating for people with dementia. Music is like the soundtrack to humans' daily lives. It's used in movies to convey emotions, celebrate another year of life, and the joys of love. It brings people together spiritually. It represents life and death. As a multi-musician, I can say firsthand that music is impactful. Anecdotally speaking, music has always been my way of expressing myself and bonding with others. I've been involved in worship music. I was in my high school's marching band as a drum major, and I played 3 instruments. But to have the evidence for the implementation of music, not only in the band, but in the medical field, is beyond exciting. Being able to express a passion like being a musician and help people beyond the scope of a musician as a medical professional opens doors to a future of art and science. It opens doors to assisting people like my grandmother and giving them a chance at a better life, even with a situation as challenging as progressive dementia. The term music is medicine can continue to become a reality with the implementation of music therapy as a more common practice among retirement homes and hospitals. Together, music and medicine can work hand in hand to become a stronger, holistic force, encapsulating both the physical and the mental needs of patients. I've included my references here,